Early data indicates the Omicron variant of COVID-19 may more easily reinfect people who have already had the virus or been vaccinated than previous variants, but could also cause milder disease. World Health Organization Chief Tedros Adhanom Ghebreyesus tells reporters in Geneva. Let's take a look.
Emerging data from South Africa suggests increased risk of reinfection with Omicron, but more data are needed to draw firmer conclusions. There is also some evidence that Omicron causes milder disease than Delta, but again, it's still too early to be definitive. The Omicron variant has now been reported in 57 countries, and we expect that number to continue growing. Certain features of Omicron, including its global spread and large number of mutations, suggest it could have a major impact on the course of the pandemic.
As well as that, more transmissible does not mean more virulent or more lethal. Yes, if we allow the virus to transmit unchecked, it will generate more. We saw that with Delta before and with other variants. If they're allowed to spread unchecked, even though they're not individually more virulent or lethal, they just generate more cases, they put pressure on the health system, and more people die. That's what we can avoid.
We have some information on severity, but we don't have the full picture yet. It will take some time for us to understand the true severity of Omicron as it compares to other variants that are circulating. We certainly have information from South Africa that many of the patients that are identified with Omicron have a more mild course of disease. But it does take time for people to go through the full course of their infection, the full course of their disease.
And we have such great vaccines available. And even with Omicron, I don't think anybody expects that the vaccine is going to, even in a worst-case scenario, would have no effect on the variant. So I think it's really important for everybody to understand that as we're talking about Omicron and the vaccines, we're talking about what adjustments there are, what changes there might be, but we're not talking about vaccines that would become ineffective entirely.